Hey there, and welcome back to the Parkinson's Disease Education Podcast. In today's episode, we're going to be talking about all things swallowing. So if you have trouble doing this on a daily basis, don't go anywhere because we're going to talk a lot more about that on the other side of the intro. Don't go anywhere. Let's get started. Welcome to the Parkinson's Disease Education Show, where we demystify the disease and empower you as the person with Parkinson's disease to reach your true potential. The content contained on this show is for informational purposes only and is not meant to be a replacement for information or advice that you receive from your in-person medical or therapy professionals. If you haven't already, I hope you'll consider subscribing, and for an even more personalized experience, please ask us about our memberships. Now, without further ado, let's start the show. Welcome back, everybody. This is going to be episode 3 of our series on communication changes in Parkinson's disease. Sarah is back with us for the episode, and this time we're going to be discussing a really important topic, really important for many reasons, but primarily for safety when it comes to being diagnosed with Parkinson's disease and having some of these changes that can happen over time. So specifically, we're talking about swallowing and the impairments that can happen with swallowing that could lead to potentially life-threatening conditions. So first, Sarah, let's talk about the overall big picture of what problems can happen, and then we can go into the specific impairments. Does that sound fair?
Mm-hmm. Sure.
So first of all, you can have problems with swallowing, which is dysphagia, where you have different phases of the swallowing cycle, if you will, can be impaired. You can also have issues with, we already talked about dysarthria a little bit in previous episodes, where you can have difficulty with speech. But swallowing, specifically dysphagia, is the main overarching issue that can occur.
Yeah. So, as you mentioned, swallowing issues in Parkinson's and other disorders, but we're specifically talking about Parkinson's, they can happen with any phase of the swallow. So whether that's putting the food in the mouth, controlling it, keeping it in the mouth, clearing the mouth of food, manipulating and controlling the food as you're chewing and taking food and drink into your mouth. There can be issues with transferring food and liquid from the front of the mouth to the back of the mouth. There can be issues with the timeliness of the trigger of the swallow. So that's triggering the throat or the esophageal phase of the swallow. And then there can be issues, of course, in the throat itself. So are foods sticking, especially things that are really thick and stodgy, like dense pudding or bread or pieces of meat? Is it sticking further down? Is it sticking more in the food tube or the esophagus? There can be issues with things not going down the right way. And that can be related to a number of different things, whether the swallow isn't triggering fast enough, is the whole laryngeal structure not moving up and forward enough to get the airway out of the way of the path of the food. Or is there an impairment in how everything is closing off so that airway isn't closing off properly when you're swallowing? So there can be a number of different reasons why the swallowing can become impaired in Parkinson's. And we have to remember that the mouth and the throat and the food tube, it's all muscles and cranial nerves as well. And we know with anything with Parkinson's that things can be discoordinated, slower, slow to start, less range of movement. So it makes sense that along with all the other physical impairments that there can be issues with the swallow mechanism as well.
Right. And yeah, it ties in with that muscle activation issue that is global with Parkinson's. There's oral phase overall, and then you've got laryngeal phase and then esophageal phase. So yeah, basically that's your process of food moving from, you've got it in the cheeks, you're chewing, you get the tongue pushing it back to the throat, then it has to go past the airway and then into the esophagus. So for those of you who don't know the anatomy very well, and I can hopefully throw a picture up here and show you, but once you have food start to go down your throat, it has to go past the airway. That's through the larynx area. And so what happens is normally the part, if you feel the front of your throat where your Adam's apple is, that's the thyroid cartilage on your larynx.
Mhm.
and you should feel it go upward when you swallow. And what's happening there is that larynx is actually raising up, and there's a little trap door at the top called the epiglottis. So that's just a little fibrocartilage, or maybe it's hyaline cartilage. It's cartilage trap door, and basically the larynx rises up and closes it off, so the food can just go right past it and into the esophagus. So once you get past that phase, you're safe as far as the breathing part of things. But this is actually a hint of a future topic. But what can go wrong when you don't have food and liquid go the right direction?
Most people have probably heard the term aspiration. So,
Mm.
aspiration is when anything, whether food, liquid, medication, saliva, vomit, it can be anything that's not supposed to be there, when it actually goes past the vocal cords, that is considered an aspiration event. So, basically, it goes down the wrong pipe. And I always like to compare it to, we have kind of a shared highway system in the throat, with the one road being the airway and the one road being the food tube.
Mm-hmm.
And they are two distinct highways, but they have a shared opening. And that's where you
Yep.
were talking about, Michael. It's so important that everything work properly so that that airway is moved out of the way and closed off when you swallow, so that things are directed down the right path, so that they're directed down the food tube.
If somebody is having dysphagia, what signs should they look out for?
Um, because it can relate to any phase of the swallow. With the mouth phase, you want to look for, am I having trouble? Am I having trouble controlling food? When I eat, is there a lot of food falling out of my mouth? Is it hard for me to form a cohesive ball of food in my mouth? Okay, because that's what you're supposed to do when you put any kind of food in your mouth. You have to form it into a cohesive bolus so that that can be safely transferred back. After you swallow, is there still food left in your mouth? Is
Mm-hmm.
there sticking along the gum line or along the teeth? As far as the throat phase, is the swallow delayed? And you'll know if it's delayed if things start going down the wrong way. You start noticing coughing, throat clearing when you're swallowing or right after the swallow. And one indicator that a lot of people don't realize is wet voice quality.
Yeah.
So, in Parkinson's in particular, there's the risk of what's called silent aspiration, meaning
Yeah.
things go down the wrong way, but the brain no longer recognizes it. So you don't do that good strong cough, which is a protective mechanism to expel what went down the wrong way out of your airway. So when silent aspiration occurs, there is no cough response, or there is a very delayed cough response. But what you can watch and listen for, does my voice quality change when I'm eating? Because if you'll remember, the vocal cords are in the airway, and your vocal
Yep.
cords make sound when you speak. So if anything passes over them, liquid or pudding or applesauce or anything, it's going to make your voice sound very wet and bubbly sounding. So if
Uh-huh.
you or a loved one, if you're noticing a real change in voice quality when you're eating or drinking, that is an indication, and a really important indication, that you should get a swallowing evaluation, because most likely what's happening is more of a silent aspiration if there's no cough
Mhm.
response.
Also,
Yeah.
something else that we were told to look out for when I worked in home care full time, to look for not just vocal quality, like the liquid vocal or the wet vocal quality, but also to look out for subtle signs like eyes watering,
Yeah,
like as if there's something irritating them, um,
that's right.
and also you already mentioned throat clearing, but that was another thing. Throat clearing, watery eyes, like a chronic watery eyes, and the vocal quality being wet. Um, and the coughing, of course, there could be coughing as well. I think most people have experienced hearing themselves or other people have a vocal quality that was wet, especially if you had some kind of mucus, like a upper respiratory infection of some kind.
Mhm.
And you cough, it clears out. But yeah, it shouldn't be there, especially not chronically.
Well, and
Big deal.
especially if the wet voice isn't there before you were eating, but then
Yeah,
it's there during or after you're eating, that's the indicator that it's
yeah,
probably aspiration related.
yeah. That's an important distinction for sure. I would think that liquid would be the most difficult thing to swallow if you're having difficulty. So why would you say that liquids are the most difficult thing to swallow if you're having an
So
impairment?
it sounds a little bit counterintuitive because when you think of what could be the easiest thing to swallow, you might first think, well, a glass of water, it's easy. There's no chunks in it. But in fact, liquids are the most challenging, especially for Parkinson's, because it takes the most timely, well coordinated swallow to control a liquid. Think about when you put a liquid in your mouth compared to a pudding. Pudding, it doesn't move very fast, it holds its shape, whereas a liquid runs freely. It's harder to control it and keep it in a controlled mass.
Yeah.
You have to have the quickest swallow with a liquid because, of course, if you're not quick and rapid and timely with your swallow, it's really easy for a liquid to trickle down the wrong way. And it's, again, the hardest thing to control in the mouth and the throat because it runs the fastest.
Yeah, that makes perfect sense. So yeah,
Yeah.
that's something to really consider if you suspect that you're having problems with this, or your loved one with Parkinson's is having problems with this. Is liquids can be the most difficult as to swallow and the most dangerous as well, in that sense, where it can go down easier.
Yeah. Now the only benefit to liquids is that it's also the easiest to expel out of the airway. So if you are just drinking water and you don't have crumbs in your mouth or bacteria in your mouth,
True.
and your mouth is clean, if you have liquid go down the wrong way like water, it's not as likely to contribute to an aspiration pneumonia, which is why we always caution people because there used to be a big push to, if you're having any trouble with liquids, you need to thicken your liquids. You need to buy a commercial thickener. You need to thicken that liquid up so that it's nice and thick and you're not going to have any trouble. The issue or the caveat with that is that thicker things are harder to cough out of the airway.
Yeah.
So unless you have been specifically tested and advised by a speech pathologist to thicken your liquids, and usually when we say thicken liquids, we only mean to about a nectar thick, which is kind of like a thick chocolate milk texture. It's not turn it upside down, pudding thick.
Right.
The more recent research is showing that that the excessive thickening of liquids can actually be more detrimental because it's harder to cough out if aspirated. So I always caution people to not follow advice on Facebook forums, or he's thickening his liquids, I should too. It's not necessarily a cure-all, and it should only be done under the advisement of a speech therapist.
That is a fantastic and extremely important point. Dr. Google and the hive mind on Meta, not always the best advice, and it's a very inconsistent advice as well. So
that's right.
You definitely want to consult with a licensed professional on this. One of the other difficulties, or one of the other things that can contribute to difficulty swallowing, is partially could be due to Parkinson's in itself with the autonomic changes, but it can also be medication related, and that's dry mouth. Dry mouth can make it very difficult to chew and swallow food, difficult to get it out of the oral phase. Let's say you may have pocketing in the cheeks, or just it's just difficult to get it back into a good bolus to be swallowed. So what would you say is a good remedy to that if somebody's struggling with dry mouth?
I would say try to lubricate the mouth as much as possible, even before you eat, especially before eating anything that's dry, like crackers or bread. The more moist the food, the easier it's going to be if you have dry mouth, like if it's an applesauce or soup or a juicy fruit. So you can always try to, take a few sips or try an oral lubricant before. And I think another important reminder is to stay systemically hydrated. Not just drinking water in the moment, but that you're taking a good amount of fluid throughout the day for your medical condition, because we know that there's some medical conditions like kidney issues that might reduce the recommended amount of fluid. But the more systemically hydrated you can stay, the more your salivary glands are going to be able to produce a good quality of saliva to help not just mechanically lubricate the food, but also saliva is important because it contains a chemical enzyme. It contains salivary amylase, which helps chemically break down the food. because they have those two benefits of the saliva, the mechanical and then the chemical breakdown. So I think staying systemically hydrated, adding extra moisteners to your food. So if you have something that's really dry, maybe adding a sauce to it, or alternating sips of liquid with your drier foods, just to help keep that moisture in the mouth.
Yeah. So something you brought up with the saliva that I wanted to just emphasize for a second is saliva having that amylase enzyme. It particularly breaks down. It's supposed to break down carbohydrates or sugars whenever you ingest them or before you swallow them, and so that's important for the digestive process. But it's also important for how you experience taste and flavor of food. That's actually how our taste buds work. Is the saliva helps to break down little microscopic bits, chemical bits of the foods we're eating, and the gustatory system, the taste system, those taste buds actually will interpret the chemical signal, turn it into an electrical signal, send it to the brain. The brain goes, strawberry.
Right.
So, or whatever it is. So you may have sensation changes with Parkinson's, taste and smell acuity changes. It may be more difficult to taste and smell, but at the same saliva, not having a saliva present can also contribute to problems of taste and smell. So in addition to the swallowing issues, I just wanted to put in for a second.
And another benefit of the saliva is that it's what helps remove bacteria from your teeth.
Yes.
So it helps to protect you from getting the dental caries. And a lot of people don't realize that the dry mouth isn't just a discomfort. Yeah. It's also, could potentially lead to dental issues. So
that whole subject of oral care, dental caries, and saliva, all that's also going to tie in with the future episode we're going to be doing on aspiration and aspiration pneumonia. So as far as getting testing done for the really kind of rule these issues in, if somebody suspects this, what are the best tests out there that are available that be performed by either an SLP or radiologist, whoever?
So I would say if you're suspecting or noticing any changes in your swallow function, whether that's just, a little bit of coughing on liquid or some food sticking in your throat or less control in the mouth, whatever it is, seek out a referral with a speech language pathologist that they can do a clinical, what we call a bedside assessment, where they check the cranial nerves, they test you with all sorts of different food textures, and then very likely they will refer you for an instrumental assessment. So whether that's an X-ray swallow study that's done with barium, or whether that is something called FEES, which is an endoscopic look down actually at your throat and vocal cords while you're eating. So I think those, especially with Parkinson's, it's important to do that instrumental assessment because there is such a high risk of silent aspiration that can occur. Sometimes a bedside assessment isn't sufficient to really know whether there's aspiration happening. Right.
And if you suspect aspiration, I think Sarah would agree with this, but it's paramount that you really get that diagnosis because you want to do something about it pronto.
That's right. And you want to be aware of the symptoms and the signs of aspiration pneumonia. And you want to just be mindful of doing everything you can do to reduce your risk of aspirating and developing an aspiration pneumonia.
Absolutely. That aspiration pneumonia topic is big enough that we wanted to cover that in its own episode in a couple of episodes forward from now. So stay tuned for that. I think that's going to wrap it up for the swallowing episode today. In the next episode, though, we're going to actually dive in a little deeper into dry mouth, also drooling, and one of the most important things that you can do to reduce your risk of that aspiration pneumonia that we're going to be talking about. Any last words before we conclude this episode today?
No, just a reminder that don't wait. Sometimes the wait list for a speech pathology assessment can be long. So if you're suspicious of a swallowing issue, get on the wait list sooner than later.
I 100% agree, especially with patients I've worked with and have dealt with this kind of issue. So thank you, Sarah, again for your expertise. And we look forward to seeing you in the next episode about dry mouth and, if you will, saliva management. Take care, everybody, and be empowered.